Welcome to Waves of Awareness, the podcast that is bringing the voices and personalities of people with disabilities to the community.
Listening along to learn more about the daily life of me and my friends, the resources available to us and our families, and how this podcast is chatting job for me and others with disability in this community.
Welcome back, everybody. We've got another episode of Waves of Awareness today. We have a really awesome episode lined up for you today. We have a full table as well. We have Mr. Tripp here as our co-host. How are you, Tripp?
Good.
Good. We also have a very special guest, Brittany. She has been a part of our early learning program. How are you doing today, Brittany?
I'm doing great. Thank you.
Good. And as special guest, we also have our early learning director, Gina Wilson, and an early interventionist that you've worked with personally, Miss Deana.
Yes.
Are y'all ready to get into this interview?
Yes.
Awesome. Tripp, do you have a question for Brittany?
What's your next steps?
No, we're going to start at the beginning.
Can you share a little bit about your Bella's story?
Sure. So I found out I was pregnant, and my whole pregnancy, I knew that something was wrong. So the job I was working at, I kept telling them that something was wrong and something was going to happen, and we needed to have a plan in place because I'm very much a planner. They kept saying, everything's fine, nothing's wrong, like, you're going to go full term, don't worry about this. And I went into preterm labor at 19 weeks. And
that's really early.
Yeah. So I went to the hospital and had a kidney infection then. They gave me antibiotics, were able to stop the preterm labor, so they thought. And then shortly after that, I went to follow up with my OBGYN and kept explaining that I was having this pain in my side. And she looked at me and she said, "You'll be fine. You just need some antidepressants."
Oh.
And I was like, okay, you're fired. We'll find somebody else. And I have a history of heart problems. I went into congestive heart failure at 2 weeks old. So I was a high-risk pregnancy my whole pregnancy. And I told my high-risk OB what had happened, and she just took over my care from there. I was 29 weeks pregnant and was at work and started having pain in my back. And when I took my blood pressure, I had high blood pressure. So I told my mom what was going on, and she thought it was best if we went to the hospital to be checked out. So I went, they ran some tests, and they said, okay, you've got a kidney infection. We're going to treat it. You'll be fine. Go home. So we did all of that. I went home and worked that Saturday because I was making up the hours that I had missed for having to go to the ER. And I was sitting at work, and one of my agents was there. I was working in a real estate company, and I looked at him, and I texted my mom, and I said, hey, I think we have a problem. And she's like, what's wrong? And I was like, my water just broke. And she's like, no, it didn't. You're only 30 weeks pregnant. Like, you're fine.
That's scary.
29 weeks, I guess, at the time. And she's like, there's no way. Like, your water broke, but we're going to get checked. So she's like, I'm on my way. Sorry. And she took me to the hospital, and I told my agent, I was like, we need to lock up. Like, we got to go.
Yeah.
And he was like, I'm sorry, what? I was like, my water broke. Like, we're leaving. We need to get out. We just lock the door and go. So I swore that I had, scarred him for life, and he was never having kids.
That would be quite scary, especially if you don't have kids already and you're like, what?
So he did not have kids. So I was like, oh, this man's never going to have kids. I, emotionally scarred him for life. And I recently found out that he did have a baby boy, him and his wife. So I didn't scare him too bad. He still had a kid, so at least he was prepared.
Yes.
For when his wife went into labor then. We went to the ER, and they said, oh, well, it looks like you're leaking a little bit of amniotic fluid, but you should be fine. So I'm like, okay, I don't think that's how that works, but okay. I mean, they're saying I'm okay. I'm going to trust what they're saying. They're doctors.
Right.
And I went home. I had actually fallen that night, so I was a little beat up. And then still went to work, I had Sunday to rest, went back to work on Monday. And then Wednesday came around, and I was at work, and I stopped and got my breakfast as normal. I had, my little frappe and my cup of orange juice that I got, and I had a crumble cookie. And I was sitting there, and I'm like, this crumble cookie plays a major role in this story. So I'm like, I have my cookie.
Not sponsored by Crumble Cookie.
I know, we're not sponsored by Crumble. However, the caramel cheesecake cookie, it's on point. So I'm sitting there and I have my breakfast and I have my orange juice. And I texted my mom. I was like, this is kind of weird. Like, I haven't felt her move. And she normally is like all over the place after I have my orange juice. Like, that was like my thing in the morning. And I was sick, my whole pregnancy, always, morning sickness was every day. It didn't end after the 14 weeks or whatever they tell you. That was like a total lie for me. It was Zofran and Phenergan around the clock, like miserable. And I'm like, okay, well, I'll try to drink a little bit of this coffee and eat this cookie. Well, there's a lot of sugar in crumble cookies and a lot of calories. Yeah. So I'm like, this will definitely get her moving. Like, she's going to be awake after this. And I ate the whole cookie and had a little bit of my coffee, and I'm like, she's still not moving. So something's not right. So I texted my mom, and I was like, she's still not moving. She's like, we're going to the ER now. And I'm like, no, we're not. They're just going to tell me I'm crazy and send me home again. We're not going back to the ER. She's like, yes, we are. I'm like, fine. She's like, I will literally come drag you out of the office and take you to the ER. So I told my coworker what was going on, and she put her hand on my stomach. And, I don't like to be touched. I'm very much like personal space. I get it, yeah. And she put her hand on my stomach, and I was like, okay, And she put her hand on my stomach, and when she did, Bella kicked for the last time. So I was like, that was weird. And I had woken up that morning with, like, severe stomach pain. And it was, like, the weirdest thing ever, because it wasn't like I had a bug or something. It was just, like, this burning. Like, something wasn't right. It wasn't heartburn, but it was, like, this terrible stomach ache. So I had gone back to sleep hoping that I just... maybe something wasn't, sitting right or something, and it was just, another pregnancy thing, and it didn't go
There's
away.
so many that no one tells you about.
Right? The amount of, like, weird pregnancy things nobody tells you about, and it's not in any book, is kind of insane. So we go to the ER, and I check in, and it almost seemed like the staff at the ER was almost annoyed that I was back. Like, oh my gosh, a third time in a week. Like, we have to deal with this. And I'm like, I'm having decreased fetal movement. You would think that like, light a fire under them. Yeah. Like, hey, let's get her in.
Those are powerful words.
Right? So they finally get me in, and they put me on the monitor. They're like, you're fine. We can see that the baby's moving. And I'm like, you're saying I'm fine, but I can't feel her. If this child is inside me, I should be able to feel that she's moving. And they're like, we're just going to send you home. Like, just keep an eye on it. And I'm like, no, I can't feel her. How am I supposed to keep an eye on it if I can't tell she's moving? So... I ended up saying that, like, I need an ultrasound. Like, you need to check on her and make sure that this is okay. So they did an ultrasound, and it was, like, one of those ones that they do, and it's not the anatomy one. I can't even remember off the top of my head what it's called. But they check for, like, the practice breaths, the heartbeat, how much amniotic fluid, and things like that. And I want to say that she had, like, less than 4 centimeters of amniotic fluid left on
And how
her.
much should she have?
I have no idea.
A lot more?
A lot more.
Okay.
Yeah, like that, I guess, is a super small amount.
Oh, okay.
And that was the largest pouch of fluid that they
could
on
find.
her.
Oh, wow.
Yeah.
Okay.
So they ended up, we're like, okay, something is wrong. So what we'll do is we'll redo an ultrasound in the morning, and we'll see if it's gotten any better.
Sorry. Door difficulties.
The ghost over there. So they admit me overnight, and they're like, we're going to give you the steroid shot and see if we can get her lungs to develop. And I was like, okay, well, that seems like, in my mind, I'm thinking that's a little bit of overkill. You're saying nothing's wrong, but now you want to give her a steroid shot to hurry up and get her lungs to develop?
Yeah.
Like, 2 and 2 is not equaling 4 here. So they're like, if we discharge you, you'll have to come back tomorrow at the same time and get another one. And I'm like, why would you discharge me if you're wanting, like...
Yeah, there's follow-up procedures.
Yeah. So I'm laying there. They admitted me just overnight for observation. And they put the monitors on my stomach. And those are hard enough to keep on. Mm-hmm. So I have them on, and of course I'm getting up to go back and forth to the bathroom. You're pregnant, you're pretty far along, and you've got to use the restroom every so often. So I get back in bed, I get them adjusted to where I can hear her on the monitor. So I lay down, and the nurse comes running in, and she was like, did you move? I'm like, well, I went to the bathroom. She's like, we don't have a heartbeat. So she adjusts the monitors again. Mm-hmm. And she's like, okay, you're fine. So she's like, lay on your side, on your left side, and she adjusts everything. So I'm laying there, and I must have dozed back off. It really feels like it was only like 20 minutes or so. It could have been longer. And she comes flying back in again. And I mean, when I say flying, like the door comes flying open and she's running at me.
Yeah.
Like shaking me awake. And I'm like,
Yeah. Scary.
what is happening? Because the lights in the hospital are bright enough. You're in a dark room and all of a sudden there's a stranger shaking you awake. And I'm like, whoa, okay, this is a little intense right now. She's like, did you move? I'm like, I'm in the same position you left me. I didn't move at all. And she's like, we lost the heartbeat again. So I text my mom and I'm like, something's not right. Like, they're saying she doesn't have a heartbeat. So we live in Spring Hill and my mom made it to Vanderbilt and it was like less than 30 minutes. That was at like 5:45.
Yeah.
I texted her and by 6:15 she was walking into the ER.
For listeners, it takes much longer than that to get
It's like a good 40 minutes, 45-minute drive.
And then
it
you're
was
talking about parking and navigation of the hospital.
Yeah.
Like, there's a lot more time.
and the parking garage. And I don't even really know, like, with the way security is in the OB floor, like, how she was able to bypass that. Because if she had to go through the whole hospital, that's like a whole nother ball game to try to get up to that floor. So my mom comes walking in the room and a team of about 19 people come in behind her. And the nurse says, well, how does today sound? And I said, for what? And she's like, you're having a baby. I'm like, no, I'm not. And she's like, yeah, you are. And I'm like, no. And then she's like, well, I have the anesthesiologist. I've got the NICU team here. I've got all these people. We're going to prep you for surgery. And I'm like, no. Like, I don't know what you're talking about. I'm only 30 weeks pregnant. Like, I'm not having a baby. She's like, yes, you are. And I'm like, okay. So I'm just going to go with whatever. Like, I've got to do what's best for her at this point. So I told my mom, whatever you need to do, you save Bella. If something happens to me while I'm in labor and I'm having the C-section, you save her. She's got more of a life to live than I do. I'm older, you know, I'm 31 now. I was 29 at the time. I said, you save Bella.
Yeah.
And the doctor is like looking at me and I'm like, I'm serious. Like, that was the last words that I said to my mom before they wheeled me to the OR. And of course, I'm sure in the back of my mom's mind, she doesn't want to hear those words. She doesn't want to hear
like,
that her
you're
daughter's
my
like,
baby.
yeah, she's not wanting to hear, oh, she's going to die, but the baby's going to live. Like, she doesn't want to hear that.
No.
So we didn't know really what it held. And, you know, she says to me, she's like, you know, do you want to try to have another baby if you lose this one? And I'm like, I don't even want to think about that right now.
Yeah.
Like, I'm literally having a baby. So they wheel me into the OR, and I'm sitting up on the hospital bed, sobbing. Sorry. And the nurse is like, what's wrong with you? And I said, I'm not having a baby today. And she's like, yes, you are. And I'm like, no, I'm not. I'm only 30 weeks pregnant. I can't have this kid. She's like, you don't have a choice. And they lay me back, and we're laying there, and they're getting ready to cut me open. And as they're like, you're going to feel pressure, my arm is on fire, and I'm like screaming in pain. And, you know, operating room, you think you've got the anesthesia, you're not going to really feel anything. And I am like bloody murder screaming. And I reached over and ripped the IV out of my arm because the IV of magnesium had infiltrated in my arm. So my arm was like bright red and on fire, and I just ripped it out. And I am a bloody mess from head to toe at this point. And the nurse is yelling at me that I ripped it out. And I'm like, then fix it. Like, I can't have this. Because it had everything going through, like the Pitocin and everything that you need to have is going through this IV that I just ripped out.
Yeah.
I'm like, I can't do it. So they finally get her out, and they hold her up over this little curtain, and she's just purple. And I'm
Not
like,
the first sight you want.
what's wrong with her? I'm like, she's not moving. She's not crying. Like, every movie you see, as soon as the kid comes out, they're screaming. And I'm like, she's not making a sound. And they run her over to this little table in the corner, like, hold her up so I can see her. I don't get to hold her. Like, you see, you know, everybody's like, oh, look at this cute picture of my baby. I don't have that at that point. They run her over and put her on this little table and start doing CPR on her while I'm in the room watching all this happen.
Yeah.
Can't do anything. I don't really know what's going on. And they eventually put, like, the CPAP mask on her, get her stable enough that I can see her for, like, half of a second. And they're like, we've got to get her to the NICU now or she's not going to make it. So they're, like, running. Like, they don't have, like, a little baby stretcher. They're running down the hallway with my baby with these machines on her to get her into the NICU. And I go back to the hospital room. that I'm in. And I don't really remember them transferring me to like the maternity ward where you go after you have the baby. And I'm laying there, and I looked at the nurse the one time, and they're like, I said, when can I see my baby? And she was like, you can't. And I'm like, what do you mean I can't? Because like, I need to know she's okay. Nobody's giving me any updates on her. I'm, loopy. They've given me so many drugs because of everything that went wrong. I don't know what's happening. I want to see my child. She was like, well, you have to be able to walk before you can go. So I had, the anesthesia and the epidural, and I can't feel my legs. So they're like, you have to be able to walk. So I'm like, oh, I can walk. It's totally fine. Like, get me a wheelchair. They can wheel me down. I can walk. Well, I still had no feeling in my legs. But I somehow made it from that hospital bed into that chair.
Oh, my gosh.
Yeah. I know the nurse looked at me, and she goes, whatever you do, please just don't stand up. I was like, okay, I won't. Like, just get me to the NICU. I won't stand up. I promise you I'll sit in this chair.
Just take me to my baby.
Yeah. So I finally got to go, and you couldn't touch her. Like, she's in this isolette, and they've got her with these little, like, cloth straps strapped down to, like, a little stretcher, baby stretcher. And, like, she doesn't even fit in the palm of my hand. She's 3 pounds, 3 ounces. So she's itty-bitty. Like, she weighs less than a gallon of milk.
Yeah. Oh, my gosh.
And her legs, there's nothing. It's just skin, like, laying off of her legs. And it was the most horrifying sight to see.
Yeah.
And then you're surrounded by all these other babies that are smaller than her, that are, like, in bags to keep them alive.
That's hard to imagine.
And I'm like, of course, in my mind, I don't know what's going on. I'm like, is that baby in, like, a Ziploc bag? Like, what is happening? Like, what are they doing here? Because I've never seen the inside of a NICU. You don't see that unless you're a parent. And it's traumatizing because you don't know what's going on. And I finally got to see her. I'm just sitting in the chair staring at this child like, that's really like mine. You have this, weird time because you don't really get to bond with her. So I'm like, I've never even got to hold my kid. And now I'm seeing her in a totally different, light than before. Yeah. She's outside in the real world.
But she can't be in your arms.
But she can't be in my arms. So I can't bond with her. I can't have that skin to skin or anything like that they say is so crucial. So I go back to my room, and then the next day I get to hold her. And as they're taking me back from the NICU after we were done holding her, I started having severe chest pain. So they're like, well, what's going on? I'm like, my chest is tight. I can't breathe. I'm having trouble breathing. And my high-risk OB was like, you have to have a natural birth. Like, you cannot have a C-section. Because I'm like, the C-section just seemed easier. Just like, I don't have to worry about the pushing and all that. Because I have titanium in my back. So I knew that was going to be a problem with trying to have a natural birth. She's like, you can't have a C-section. Well, I had to have one. So now what do I do?
Yeah.
And all of the fluid that should have come off of me didn't. It stayed on me. So it started to go around my heart.
Oh.
So one of my best friends works at Vanderbilt, and he had come over to see me. And he was actually standing in the hallway as the whole medical team comes running in my room because my heart, I can't breathe. I'm gasping for air at this point.
Yeah.
So they're doing, the cardiologist is in there. They're doing EKGs, echoes in my room, like not even taking me somewhere to do the things, trying to figure out what's going on with my heart and how we can get the fluid off of me. And they had given me those 3X hospital grippy socks to, walk in. And they were so tight, they were cutting off the circulation in my legs.
Gosh.
So it was like super, super swollen all over. So I had to stay longer than most parents because nowadays it's like you have your baby, you're discharged like 24, 48 hours. I was in there like 4 or 5 days after I had her.
Wow. Yeah.
So then I finally get to leave, and nobody talks about that when you get discharged from the hospital, but your baby doesn't. So you have that. It felt like it took an eternity to walk to the car because you're in the parking garage and you're walking out without your child. Yeah. So I'm like, now I have to trust that she's safe here. I know it's a hospital. What can happen? But you're leaving your baby.
A lot happened to get there.
Yeah. So you go home, and then you're home. You can go visit, but how long can you really stay there? You can't stay overnight in the NICU. So I'm there, you're pumping, you're having to take milk back and forth to the NICU so they can give your baby milk. And you're just waiting for that phone call, and you get a phone call from like a number you don't know, and your heart just like sinks in your stomach. You don't know if something's wrong. You don't know if your baby's going to make it through the night at this point.
Yeah, it's the height of anxiety. Yeah.
So, you know, she's got the high bilirubin. They've got her under the lights. We've got this problem, that. Her blood work's coming back, that her white blood cell count's elevated. Her lungs had collapsed. So we're dealing with all of this, not being able to be right there. Mm-hmm. So you'll get a phone call, hey, we have to do a procedure to reinflate her lung. And I'm like, that's what every mother wants to hear. Like, thank you. Because I'm not dealing with my own stuff.
Yeah,
like,
gosh.
On top of getting that in a phone call, not like a face-to-face. So she was finally transferred about 2 weeks after her NICU stay in Vanderbilt to Children's. And when we were transferred to Children's, we were allowed to stay there with her. So the nurses at Children's would actually like force me to go home. I think there were only 2 nights that I went home out of the other 4 weeks we were there. And they would force me. They were like, you got to go home.
Yeah. Well, you have to take care of yourself.
Exactly. They're like, you can't take care of her if you are, you know, exhausted.
Yeah.
I was that one that anytime her alarm sounded, I would jump up. I just had a C-section. I kept ripping my incision open. They're like, you have got to take care of yourself. You've got to go back to the doctor. You've got to get this looked at. So they would force me out for a little bit. They're like, get some air. Like, get out of this room. And we had a wonderful nurse there. She was our primary. And she did everything that she could to help us. So she tried to walk us through it. You know, you would, on occasion, have your counselor come in. That's like, how are you doing? I'm like, I'm great. You know, I got a baby in a NICU. I just had a child. I'm wonderful. Like, please, like, let me handle her. You don't want to talk at that point because you don't really even know yourself what you're going through. So we get home after 6 weeks of being in the NICU. And then, you know, while she was there, she had an ultrasound and was told she had a cyst on her brain. Since she was so early, she would never be able to walk, talk, read, all these disabilities that she was probably going to have. She'd be on the spectrum.
Telling you all the things that she won't ever be able to do.
Yeah. So, like, you already are having this mom guilt that you had your kid early, and now you're hearing all these things that your child is never going to be able to do. So you've got this in the back of your mind of can I fix this? What can I do to stop this? We got a nice letter in the mail saying that, hey, you have to take your child for an eye exam because she was a preemie. And if you fail to, we're going to call DCS on you. And I'm like, that's super reassuring, right? We took her for the eye exam, and they said that she was at like a stage 0, stage 1 for ROP. We would needed to come back in 6 months, and then we would see what happens. Now I'm losing my voice. I'll let you take over.
Okay. So I'll let her come back in this. Actually, she told me, that I had told her today, I said, no, you don't have to come. Bella has had pneumonia, and she's been sick also. Oh, but that's who she is. And
thank you, Brittany, for being
I'm sorry. It's just...
That's who she is. Honestly, parts of it, I didn't know her whole birthing story. I'm saying, oh man, we've had a wonderful working relationship. But I didn't know until later when I'm listening to her story. I'm listening to her story, and she didn't know that I had the same story, except for I didn't have anesthesia. And I had a C-section without anesthesia.
Oh, gosh. What a serendipitous pairing.
I had no idea, you know, and I was listening to her, and I was like, oh, good gracious. And she is a strong mama that would hold me to the line. And, yeah.
You've been there.
She would hold me to the line. If I wasn't doing my job, you all would have heard about it.
100%. I think a lot of it was trying to get past that initial, okay, she's a baby, what do you do with her?
Yes. Yeah.
And then getting through the feeding.
Yeah.
That was a big thing. So I think our first real thing was switching over to like solid foods and rolling over.
Yeah, because we would ask, you know, when we go in, I mean, our typical, the way I do it is when I'm on there, hey, tell me all the good stuff. Tell me everything good that's going on.
Yeah.
And
well, you can't forget those things.
Right.
You can get so bogged down into like, oh, she's not doing this, she's not doing that, and she's not hitting this, and all of the negative things have a tendency to bubble up. You can't forget the good stuff.
But then there's those wonderful things like, oh, she did this. And even if it was something she did that she probably shouldn't have been doing, it's wonderful
She was
now.
doing something.
Oh, yeah, because now we get to hear, now I get to hear that she's using words she may not use the words that she should be using, but she's using them, and it's appropriately.
It sure is.
Yeah.
Kids have a way of figuring that out real fast.
And so, and also on here, so we would be doing our sessions, and her mom, Brittany's mom, would join in, and well, she has she's called Ham Haw.
Yes, that was one of Bella's first words.
Hem haw?
Ham haw. It's not
Okay.
grandma.
Okay.
It's ham haw.
Ham
Hem
Haw.
haw. Okay.
And so I think we were getting through the baby stages. We would get through all the rolling over. This is what, okay, she's doing this. Now, this is what we might start looking towards.
Yes.
Fortunately, we were able to kind of go through all those milestones the way that we should have been going through them. And because I don't go by age and I don't tell you a number, but I go by this is the next step. And I think
And I think that's a beautiful thing about developmental therapy that we have.
exactly.
Yes.
It's like, I'm not going to say this age. It's going to be, we've got to do this next. And I might be wrong, but I think one of our ones that, like, your mom joined in, and I was like, so what do you all, what's your concern? What do you think you really need to work on? And I think your mom's, one of her first ones was it just the sitting. That was like,
Yeah.
And then after she got the sitting, then it was like, I mean, she was in the crib. She was jumping. She was out of it. She was,
I couldn't keep her in the crib. I could not. This child is an escape artist. Like, I would wake up in the morning and
Get
she's
up and
out.
go.
And I'm like, where did you come from? Just like overnight.
You.
Yeah.
and then she started having this extremely strong personality. And so Ham Haw is always in there on the sessions too. And sometimes I'd be like, okay, I need to ask your mom something just a minute. Is this different, or is Bella's mama just like this too?
Yeah. Good question.
And
Is
she
it
was-
genetic?
A little bit. A little bit.
Yeah, a little bit. Yeah, because she's like, yeah, she's like that. And then we hit a point that was very traumatic for all of us.
So that point was everybody hears the rule of thumb, 1 to walk, 2 to talk. So she started walking. Oh, gosh. I don't need to cry on top of already not having a voice. So being told all this stuff, you have all these, like, horror stories in the back of your head. So is she ever going to be able to talk?
Yeah. Well, I mean, you were told she would never be able to walk or talk.
So now that we've mastered the walking, I mean, she's running down the hallway and going crazy. But she's still not talking. She's not babbling. She's not doing any of the things that she should be doing at this point. So we're like, okay, well, let's get a speech evaluation done. And I mean, I think she was, probably 18 months old?
And her service coordinator, Andrea Smith, and I were, we're watching everything, and we're both, we're seasoned. We're not old, we're seasoned. And we're watching her, because all these sessions are on Zoom. But we're really feeling good about it. We're feeling good about the coaching. We're feeling about what's going on. And then we're feeling that Bella, her receptive language is good. We're feeling pretty good about it. And then Brittany gets this evaluation back. Brittany runs the show. I mean, and she should. That's what this is
bit.
about.
Yeah.
That's what it's
I
about.
don't know where Bella gets it from. I mean, definitely so.
So when we were seeing things that might be on the spectrum, I was like, I met her mama. So, but when she lost her service coordinator, and she took the steps and she got her service coordinator back.
And Gina, can you describe the importance of a service coordinator with this relationship with the early interventionist and the caregiver or the parent? What does that look like, just for people who might not be familiar with this whole process?
Okay, the role of the service coordinator is to guide the team when a referral comes in and that child is deemed eligible. Then that child is referred to the service coordinator, and it's the service coordinator who gets all of the other therapies in place, such as developmental therapy with WAVES or another provider, and then they will also call in or not call in other therapies, ancillary therapies like speech and PT and OT. So it's our service coordinators who make sure that the other services are put on the IFSP or that child's plan.
And then we got the evaluation back because it took, I'd say, probably 2 or 3 weeks to get the evaluation back on her results. And I walked out of that initial evaluation. I was like, she did great. She did things I didn't even know she knew how to do. She was stacking blocks. She could do this puzzle without ever trying to. She's never played a puzzle before. I didn't know she knew how to do that. I was like, she did great. Well, little did I know. Hey, apparently she didn't. And they were saying that she was going to have all these things. And, of course, as a mom, what do? I'm not a doctor. I start Googling things. Well, that was the worst thing I could have possibly done.
Dr. Google. Not the best.
And then in the very last paragraph, it says, needs an autism evaluation. And I lost it. I mean, I was sitting at work with my door shut sobbing because that's not what any parent wants to hear. You think your kid's perfect.
And that's not how you want to hear
No.
it. Yeah.
Not that they picked up the phone and called me and said, hey, I think there's concern for something else. It's you're reading it on a piece of paper with nobody going over these results with you. So I've never hit forward on an email so fast in my life. And I forwarded it to both of them, and I want to say we were on a group call. Where did we go wrong? Where did we miss this? Because I knew that there was the possibility of this with all of the issues that they told me she could have, and with family history, that her cousin didn't talk until she was like 4. So I'm like, and she still barely talks, and she's going to be 6. You know, there's issues here underlying, and we need to get to the bottom of it. And I mean, reading everything that was in that and Googling it, it was like, she'll never be able to read. She'll never be able to form sentences properly. The, like, phonological disorder, expressive language disorder, all these things that she has. So I'm like, okay, let's add it to the list of things that's wrong with her at this point, because what am I doing? Where am I failing her? Because I felt like I had done everything possible for her. And we all jumped on a Zoom, and there were a whole lot of tears that day. I mean, sobbing, because it literally was so personal. Because as a mom, you want to do everything in your power for your kid to succeed, and I felt like I had failed her. If I could have done something to prevent her from coming early, whatever that may have done, I don't know what I could have done, but if she wouldn't have been early, maybe she wouldn't have had this. Maybe I did something wrong in my pregnancy that caused these issues. I think that mom guilt that everybody gets. And they talked me down that I didn't do anything wrong, especially Deana. And she had to get through my very thick skull that it was not something that I did. And I tell you what, this child now will grab a book, and it might not be the right words, but she'll tell you a whole story. She'll go based off those pictures.
Yeah.
And she can read a whole story. Like I said, it's not exactly the words that are on the book, but she'll read it to you. And
she's interpreting and telling and sharing. Yeah.
She's like, look, pizza. He's eating pizza. And I'm like, sure, that's nowhere in the book. It's in the picture, but he's eating pizza. You got it. And I mean, she doesn't stop talking now. So being able to overcome that and have that where it was such a big concern, such a meltdown on my behalf, to now her being able to narrate everything. Like her favorite movie's Encanto. Well, she can narrate that whole movie. She doesn't know what there's, like, I'm sure she knows what they're saying in it, but she'll be like, look, chairs, dancing, sliding, look at the picture. And I'm like, I see all this.
Yeah.
That's what's happening in the movie.
Yeah.
But she emphasized narrate everything. Well, I did.
Narrate.
I love it.
Now that's what she does, everything. Look, Mom, she said it to Hamhaw on Tuesday. She said, look, a soda truck. And I'm like, I've never called it a soda truck. It was a Pepsi truck dropping off soda.
Oh, wow.
And she knew exactly what it was. So she really likes to narrate now. And I feel like had I not had Deana and our service coordinator, Andrea, by my side, I don't really know at that point what I would have done throughout this process. I mean, I don't know anything about being a parent. I read all those books that they tell you to read, and it didn't make a difference. Once you have the baby, anything you read or any advice anybody tells you, that all goes out the window. You don't remember it. You're sleep deprived. You're trying to, fight for your own life here, take care of a new child. I can't even keep a plant alive. I'm trying to figure out how to keep a kid alive. Like, it's a whole thing.
A little more maintenance.
And you like to have that order, and this is the way it's going to work.
Yes.
And she does work for the military.
Yeah, I do now.
And she likes to have it that way, and for it to be that way. And I want to say, as my part as a developmental therapist, that's why listening, and then you do feel that parent's pain. We weren't
That's a lot to take
Right,
on.
we were. And my personal opinion, if you're a professional, you're not really second guessing what you are, but you always want to be best. You always like, what could I have missed? What could I have done? Like you, what could I have missed? What could I have done? And so her service coordinator and I together were like, I don't think we could have missed this. How could we have missed this? How could we have not been preparing her for this to maybe happen? Because we would have. We would never make a diagnosis, but we would have been preparing,
Yeah.
her for this, and we weren't preparing her for that.
You weren't prepared for it.
No, because we thought she was doing excellent, and she is doing excellent. And now she does have a hot, feisty temper.
Those are my favorites.
You have no idea.
And but then again, like sometimes I would have mom cover her ears, and I would ask Hannah, "Is this like? Did you raise the same type of child?" Yes, I did. Okay, so is this like, And
Is
and
it
like
to be expected or not?
yeah. So we're through this experience, it's like I've shared. I felt a little different because I was doing Zoom. And I was like, am I able to give them enough? And but it worked great for us. And the first time I ever saw Bella in person was just a few months ago. And she knew me well. And she came right to me. And
I think that's evidence that you did something right.
it's worked really well. We kind of have a routine with us. It's kind of always hard to stay on the routine. But I think that teamwork was our best part because we were all part of the team. I mean, and she was the leader of that team. And I'm going to share because she's lost her father during us. She's had a lot of different traumas go on during our times together. But it's worked. It's worked great. And it's so great that she was not very happy when Bella said Bella's no longer going to be in our program.
Yes, we had to be evaluated by the school system, and probably I don't know how much I should say. You might need to filter some of it out. I may have tried to bribe Bella to fail the test.
Oh, Lord.
I'm like, I will buy you Chick-fil-A. We will go shopping. I need you to not talk.
Oh, Brittany.
I didn't put her glasses
She didn't
on
go with her glasses.
I literally left her glasses at home. I was like, she's not going to pass this. No. They're like, she's like the smartest kid I've ever seen. Her IQ's so high. And I was like, you're not getting Chick-fil-A.
And we had found out that, we didn't really know that she needed glasses that much. But
Yes.
this is normal because her eye did start pulling in a little bit,
Yes.
which, it's kind of normal for that to happen at that age. And so she went and had her eyes tested, and she was like, I can't hardly see. And I was like,
It's so
maybe
bad.
that's why she's been bumping into things.
Yeah.
I have her in occupational therapy, and they're like, have you had her eyes checked? Like, and we started to notice in pictures, and I was so mad. I paid for these Easter Bunny photos at the mall, and you know how expensive those are. And every photo I got back, her eye is turned in. And I'm like, seriously? And it was how I realized it. Like,
Yeah.
before I didn't think anything of it. I was like, oh, she's tired. Like, no big deal. No, but I took her to the eye doctor, and they're like, her eyes are really bad. She's got to go see a specialist.
Oh, gosh.
So, me being me, and they're like, oh, we can get you in about 6 months.
Oh, no.
That didn't fly for me.
Nope.
So I got some more strings pulled, and we were able to get her in really quick. Thankfully, I did have to self-pay for her glasses that first time, and good Lord, those are expensive. But now we
Don't
have her
lose
in.
'em.
Yeah, right. We have her into an awesome specialist, and they did say that this ROP, well, that's when I started to get choked up, was about her eyes. When we went back for her 6-month visit, they're like, she doesn't have it. You're good. She won't need to come back. Well, then I go through her medical records, and it says come back on her 2nd birthday. And I'm like, you didn't tell me to bring her back.
Yeah.
And you didn't make an appointment. So now we have to go back, and now we're having this eye issue. Well, guess what? It's part of ROP. So we've got this retinopathy of prematurity we're dealing with the eye turning in, and then we put her in occupational therapy. She's clumsy. She's fallen into everything. Granted, I'm 31 now. I run into everything, too. I've got bruises all over me. I'm like, oh, it's,
Do you need to go to
genetic.
the eye doctor?
Yeah, I've got my glasses in the car. I'm like, yeah, I can read this. It's big enough font. But it's things like that I'm like, oh, no big deal. She's a kid. She's clumsy. No, she just couldn't see. So then I felt bad for that because I'm like, I waited how long to take her to the eye doctor, and here she couldn't see the whole time. And
But now she can.
now she can. She does great with them. She can see. She can narrate. She reads her books.
She cooks me meals when
Yes.
we're doing our Zoom. I can order what I want. She goes over and cooks it on her little stove.
I love that.
Yes.
Yeah. There's things that she does like her way.
Yes, she does. And I will say, we had our session back in January, and I was kind of saying a little bit of it before. It was a very hard month, and Deana knew that my father was getting really bad and was getting sick. So every time she'd check, how's your dad doing? Is there anything, I'd get a message here and there throughout, hey, how's everything going? And we had our session the week before he passed, and they acted more as a sounding board for me that session than, okay, let's talk a little bit about Bella, but how are you doing? Like, you need to be okay, because if you're not in the good mental state, like, we're not going to be able to do what's best for her. And they really, anytime I needed anything, reached out to me right away. How are you doing? Can we help you with anything? And I want to say they were one of the first few people I told after Dad had passed. I think they knew about it before my work did. So just having that support system through your whole life with your kid. Mm-hmm. And, it's been 3 years, but that's her whole life. So just having them there, it's not just teamwork, it's become part of the family.
And that's why this is a family support.
Yeah, it really
Right.
is.
Yeah.
And sometimes I think that you have to because everything that's going to go on is going to affect, that child and how we're moving forward.
Yeah.
And so we were able to really put all those pieces into place. And now here we are, and we only have one session left.
Oh no.
Yes, she unfortunately passed that test in the school system with flying colors.
Well, she failed her first one. She's come so far.
I know, right? And they're like, did you know her IQ's this? And I'm like, she clearly got that from my side of the family. That's all me.
So Deana's going to need some extra support next week.
Yes.
Is that what you're telling me?
And that's
Yes.
why she's brought me cookies.
Bella made those.
Bella made these cookies.
Yes.
Oh, that's sweet.
And we've got the next steps, and the next steps are not going to be me telling, I'm not going to be in those next steps.
Oh, but you are.
I was going to say, she thinks she could get rid of us, but she can't.
You are.
Have you met Brittany?
That's what I said when I was like listening to her beginning story. I was like, oh my goodness, this girl is like, I wish I could say I taught her that, but no, that's her personality. And that's my personality.
I'm a little fiery.
I'm old, but my fire's still there. And the things that you were saying, it's just like I'm like, no, I'm not having this baby today. No, I'm not doing this. But you did it, and it's been great, and it has been, I would say, what it should be. This is a picture of what it should be, and I can say that because I've been doing this a very long time, and it's been absolutely wonderful, and I've been so grateful to be on this journey.
Thank you so much. I know I couldn't have done it without your help. Like I said, I was the one that it's like, okay, what's next? Like, what do I need to be looking for? Because I don't know what I'm doing. Everybody I see that has kids, they don't talk about that stuff. It's just like, oh, 1 minute they're walking, then they're talking. I don't know the nitty gritty that goes into it. I was never having kids.
And I think that's something that comes in handy because we're kind of like, we're the mom that you can't go to your mom for.
Yeah.
Because we've, usually like, oh, they should be walking at 12 months. Well, not necessarily. That's just your regular kiddo there, And so we can provide that. And being a good mom is also teaching someone to not need you and giving those strengths. I didn't have to give those to her, but I was there to support that and I was share. We were in OT and we're talking about, well, Bella's still having these meltdowns. She's doing this and that. And so I'm like, well, what are you doing in OT? Well, they're cutting and stringing beads. I said, why did you go to OT? Remember, why were you referred to OT? And she's like, because of these meltdowns. Mm-hmm. And so I said, well, what do you think you want to do about that? Mm-hmm. And that's you did it. You do it. You take care of it.
And I mean, meltdown seems like it's putting it so lightly. I mean, we'll have like our temper tantrum, like, oh, we're going to cry and scream and, hit the ground and things like that. But when I mean meltdowns, her cousins and my sister moved in with us last May, and she will go, nose to nose with a 9-year-old cousin.
Oh.
He's going to be 9.
It's more like WW.
It's like WWE in the house. Like, he got upset about something, and she got mad, and he was sitting in the recliner, and she reached up and pulled him off the recliner and drug him into the kitchen.
Oh.
She's 2, going to be 3.
Wow. Okay.
And no fear. I mean, when I mean meltdown, I mean meltdown.
Of course.
So I'm like, okay, we've got to figure out how to regulate this, because she can't be a bully when she's in school. Like, I don't want, I want my daughter to lead a company, not a gang in prison.
All good goals for parents.
I mean, it's the truth. I want her to be successful.
On her parenting. I think that was on your goals. Yeah,
it was. I want her to be successful in a good way, but not use her anger and all her emotions in a negative way. And I need, at 2, that's hard to try to figure that out.
So we have talked about some other things to do and try to continue. And I don't know if you're going to continue OT and things after us. I'm not sure what your plan is.
I don't think we've thought that far through yet, to be honest. We're just pretending that this isn't happening. So we're staying in Waves forever. Oh. You can't get rid of us.
Gonna have to expand our early learning program.
Yes, right. It's like, no, you're still here.
Who do I need to petition to get this bumped up? Because clearly I can do that.
Gina's in charge.
We'll talk after.
Call me.
Well, I think Tripp has another question for you, Brittany.
What's your advice if you're a parent early learning?
So I would say, at least in my case, early learning and these programs were given to me in the NICU. And I will tell you, at that point, I didn't really think anything of it. I'm like, she's 6 weeks old. That's down the road. Like, I don't need to worry about that right now. I need to get her off of the machines and the feeding tubes. I would say take what they're telling you with a grain of salt. And that's a lot easier said than done. And Deana knows that. It's a lot harder to hear, hey, your child is going to have this or that, or you should really go ahead and get them in developmental therapy, because I feel like a common misconception is if you put them in developmental therapy or early learning or speech therapy, something's wrong with them. And you don't want your kid to be looked at as, oh, well, there's something wrong with you. That's why you need this service. So to me, I'm like, if somebody's willing to help, I'm going to take any advice I can get. So just take that initial, hey, maybe we should try early learning. Let's help you with developmental therapy, help you learn how to raise a kid, things like that, those milestones. Take it with a grain of salt and don't take it so personally. And I know that is so hard from mom to mom. You're not going to do that. It's going to be this mom guilt and this mom instinct. You're going to think something's wrong. It's not that something's wrong. It's giving you the steps you need to succeed. And that's really what we saw with Bella.
Yeah.
So Staci and I just went to a luncheon, and there was a quote there that we both liked. And so I think that quote would be appropriate right now.
Yeah, it's very applicable for you, Deana.
This is for Deana. You want to read that for her?
Leadership is about making better result present, making impact your exhibit in a must.
That's right. Do you want me to read that again, too? Okay. All right. Leadership is about making others better as a result of your presence and making sure that impact lasts in your absence. That's got Deana written on it.
And as the waterworks starts to flow, guys, I think we're going to wrap this episode up. Brittany, thank you so much for being here. Deana, thank you.
Thank you. It's been wonderful.
Amazing. Gina, thank you for being here too.
Thank you.
And Tripp, as always. I'm so happy you're here with us today. Do you have any parting words before we go? No questions. Do you have any parting words? You want to say bye?
Bye.
Bye, guys. Thanks. This is another episode. We'll see you next week.
At Alegria Electric, we offer residential and commercial electricity service. Enjoying reliable service, energy efficiency, expert support, and flexible solution tailored to your needs. Maximize productivity and minimize downtime with our commercial electricity service. From a small enterprise to large corporation, we got your power need covered. Contact us now to learn more about our residential and commercial electricity service. You can reach us at 615-930-8409.
Thanks for turning into another episode of Waves of Awareness. We are glad you're here till next time.
Waves of Awareness is a Waves Inc. podcast and made possible thanks to Spread the Positive, the Community Foundation of Middle Tennessee, and Tennessee's Department of Intellectual and Developmental Disabilities. For more information, visit us online at www.wavesinc.com/podcast.